Hello friends, hello doctors, and today I will be sharing you with memory-based questions of Inicet 2022. And so, first question: maniac patient with on treatment since 2 years, and she wants to conceive now. So, the most teratogenic drug is the options were lithium and valproate, the most confusing ones. So, the answer is valproate because this is low therapeutic index and high toxicity. So this is used this is the most teratogenic drug as compared to lithium. Now, which a brand makes a paracetamol of 400 mg but it has only a 200 mg? So what it is called? So it is called misbranding and counterfeit drug. This is the answer: misbranding, not spurious drug, not nothing. The answer is misbranded counterfeit drug. Now, which of the following is not a checkpoint inhibitor? So the options were ipilimumab and cetuximab and pembrolizumab. These were the options. The answer is cetuximab because ipilimumab and pembrolizumab are the checkpoint inhibitors. Now, patient on risperidone come to emergency with fixed upper gaze. So, what will be the management? It is due to acute dystonia which is caused by risperidone. So, the answer is promethazine, which is used for treatment of acute dystonia. Now, muscarinic poisoning came to emergency. The most consistent feature will be bradycardia. The patient will present with bradycardia if there is muscarinic poisoning. Now, ATT drug with mechanism of action mycolic acid synthesis which needs catalase enzyme. So this was asked ATT drug. So the answer is isoniazid, which needs catalase enzyme for mycolic acid synthesis. Now, OHA causing bone fracture in females. Now, the glyphazones cause bone fractures in females. The OHA which cause bone fracture is canagliflozin. The option was canagliflozin. The glyphazones cause bone fractures, not glitazones or voglibos. These are not the correct answer. The answer is glyphazone. Now, active metabolite of cyclophosphamide. So the active metabolite of cyclophosphamide is aldophosphamide. Not a first line drug in treatment of rheumatic arthritis. So methotrexate was given, that is the first line drug. HCQ is the first line drug, and sulfasalazine is the first line drug, but azathioprine is not the first line drug. It is not the first line. This is the answer. Now, letrozole was asked. Half life of letrozole. So 45 hours is the answer, not 70 or not 90. There are many confusions about 70 and 90, but answer is 45. Now, drug used for treatment of advanced endometrial carcinoma. So pembrolizumab is the correct answer, and it is also a checkpoint inhibitor. This was also asked, but a different option was there. The question was a little different, but this is also a checkpoint inhibitor. Pembrolizumab, it is used for the treatment in the advanced endometrial carcinoma. Now, drug of choice with a patient of chronic alcoholic patient with raised liver enzymes like AST is 180, ALT is 140, GGT is 563. It is so much raised with the altered sensorium. So what will be the drug of choice? So drug of choice will be lorazepam and not diazepam. Other options were diazepam, alprazolam, and clonazepam. But the answer is lorazepam. So this is the part 1, and I will be telling you more memory based questions. So stay tuned and for the next part. It will be coming soon.